Singapore will lift all remaining COVID-19 measures from next Monday. Now, this as the situation here stabilises and the country prepares to return to normal life. A mask wearing on public transport, as well as indoor healthcare and residential care settings, will no longer be required as part of COVID-19 regulations. Singapore's disease outbreak response will also move down from yellow to its lowest level, green. And that's because of the nature of the disease is now deemed to be mild and it poses minimal disruption to our hospitals. In light of the stable and improving global COVID-19 situation, all remaining border measures, they will also be dropped. All non-fully vaccinated travellers entering Singapore won't have to show proof of a negative pre-departure test. Vaccination, well, it remains Singapore's first line of defence. It will continue to be offered free to those who are eligible. Meanwhile, the Trace Together app, well, that can now be uninstalled and safe entry is no longer required by businesses. But should the need arise, both systems will remain ready for reactivation. Sherlyn Sia lays out the considerations in lifting remaining COVID-19 measures.
It's a carefully assessed move, with the country now in a stable position. That's a phrase that was mentioned multiple times by Singapore's pandemic task force in announcing the new changes. There have been no new dangerous variants nor increase in imported cases. And people here now have what's called hybrid immunity, with more than 8 in 10 vaccinated against COVID-19 and 9 in 10 having had the disease before. The situation in hospitals, which authorities have consistently said is the real indicator for severity, is also stable. And there's also increasing evidence that COVID-19 is of similar risk compared to other endemic diseases. Last year, there were 800 deaths linked to the coronavirus compared to over 5,000 from other respiratory illnesses.
MOH will continue to monitor healthcare capacity. If there is a new and dangerous variant, or if our healthcare capacity becomes strained, then we may have to revise the DOSCON level, we may have to reactivate community and border measures, and we may have to reactivate a multi-agency crisis management structure like the MTF. We hope this will not happen, but we have to be mentally prepared for such an eventuality.
One thing that stood out for reporters was a somewhat equal emphasis on the possibility of future curveballs. And so Singapore will continue its surveillance both locally and globally. There have also been valuable lessons learned from COVID-19, and Singapore's pandemic management framework continues to be in place.
We are now in Senang Diri position, but we are not Keluar Baris. We are all taking one step down at ease, but must be ready for the next VOC or pandemic. And especially for healthcare sector, we are still in line. We have to be ready. COVID-19 has taught us valuable lessons and helped us build significant capabilities, and certainly for the healthcare sector. And we will use them to the fullest, do our best to improve the health of our people.
The government has also reviewed Singapore's experience with COVID-19 these last 3 years. As we have highlighted before, we are undertaking a comprehensive after-action review to set out what we did right, what we could have done better, and how we can better prepare ourselves for the next pandemic.
The report will be published when it's ready and tabled in Parliament for full debate.
Singapore's COVID-19 multi-ministry task force will stand down next Monday, but it says it will be, quote, operationally ready should the need for it arise again. The MTF was set up in January 2020 to helm the government's pandemic response. Alif Amshar revisits its journey through the pandemic.
As COVID-19 started making its rounds, Singapore too was on its toes.
Both China and the World Health Organization have also reported and confirmed that it is possible for human-to-human transmission.
Soon, briefings like this to update the public on the pandemic became a familiar sight. And as the situation worsened, tough calls had to be made.
Today, the task force has deliberated carefully and decided to raise the risk assessment to DOSCON Orange.
In early April 2020, it was announced that Singapore was to enter a circuit breaker period to contain the spread of the virus.
Under this new phase of a national circuit breaker, all of us have to reduce our contacts significantly, limiting it only to the people who live around us.
During that period, other changes had to be made.
We will now take a further step and make it mandatory for everyone to wear masks when they go out.
In December that year, the task force shared recommendations of a vaccination strategy for Singapore, starting with jabs for healthcare workers. And when marking its first anniversary, the MTF assured the public that there was light at the end of the tunnel.
We say this almost repeatedly, so at risk of saying this again and again, that it's not over, it's a long fight. Yes, we can see the end in sight because we have a vaccination in place.
Over time, Singapore achieved a very high vaccination rate. It also learned to live with the virus.
As we become more COVID resilient, we are now able to take further steps to adjust our measures. So first, we will remove mask wearing in indoor settings from 29 August.
But the MTF wasn't stood down then because of uncertainties related to virus mutations and their possible impact. Today, though, it's a different story. The COVID-19 situation has remained stable in recent months, and the Health Ministry will take over its management. But having said that, the task force can be reactivated if needed.
We are continuing to maintain a high level of alertness and preparedness, so we are operationally ready, to use the words of the SAF. Anytime the button is pressed, we will stand up again.